If you've ever noticed a small bump on your eyelid, then you may be having a condition called Chalazion. In this video, we will go through everything you need to know about Chalazion, including its triggers, symptoms, and available treatments. But before we get into it, be sure to like, comment, and subscribe to our channel for the latest face and eye aesthetic content. So what are these eyelid bumps, and why do they form? A chalazion is a small bump that occurs on the upper lid due to a blockage of the oil glands. We have hundreds of oil glands on our eyelids just behind the lashes. The blockage may occur due to various reasons such as excessive oil production, makeup usage, poor hygiene, or even a bacterial infection. At the start, you may not notice the chalazion as it may not be painful. Thereafter, you may notice a small bump. The eyelid may also get red and painful and swollen. As the chalazion gets bigger, it may press on the eye and cause blurry vision, and in rare instances, the whole eyelid may swell up. After understanding what chalazion is, do you know how it differs from its more popular cousin, also known as the stye? So while a stye occurs further out on the external of the eyelid, a chalazion occurs further backwards. Also, a stye is usually more painful. There may be some pus found in the center of the stye. There may be some crusting of the eyelid, and the lid may also be red and swollen with a stye. Having covered both conditions, let's zoom back on the treatment of a chalazion. So how do we treat chalazion? In most cases, chalazion resolve by themselves in about 2 to 8 weeks. However, if it's persistent, do consult the doctor, and the doctor may prescribe one of these treatments. Number 1, warm compress. You can apply a clean cloth soaked in hot water or warm compress on your eyelids for about 10 minutes 3 times daily. What the warm compress does is that it opens up the oil glands and allows draining. You can also increase this drainage by gentle massage around the eyelid area with clean fingers. Number 2, medications. Your doctor may prescribe oral or topical antibiotics to help resolve this chalazion faster, and also may prescribe a steroid shot to resolve the inflammation. Number 3, if the chalazion is persistent or big, you may require a simple procedure or surgery to drain it. This is usually quickly done in the doctor's office under local anesthesia and takes less than 10 minutes. Recovery is also quick. So let's break down the steps of the chalazion removal. So first, the doctor will clean the area and inject some local anesthesia, which will be slightly painful like a big ant bite for a few seconds. Thereafter, we put a clamp to evert the eyelid and make a small cut on the inside of the lid so there's no scar on the outside. And then we'll do a simple drainage of the blocked content inside the oil gland. Thereafter, we'll put some ointment and eye pad, which can be removed after 1 hour. So this is all usually done very quickly, less than 10 minutes in the doctor's office. Together with the prep work and anesthesia, it may take slightly longer. A recurring chalazion may require a biopsy, which is to take some tissue and send for testing to rule out any other condition that may not be solved with the above treatments. Treatments aside, what should you not do to prevent the worsening of the condition? As a rule of thumb, do not try to pop or squeeze the chalazion, as this could spread the infection further along the eyelid. And also, number 2, avoid makeup or contact lenses when you're having an active infection. The best way to prevent the chalazion is with good hygiene. Firstly, wash your hands before touching your eyes or anywhere near the eyelids. 2, wash your face thoroughly to remove any dirt or makeup before going to bed. Number 3, change your eye makeup regularly to ensure that it's not expired and to avoid any infections on the eye, and make sure that you remove your eye makeup thoroughly before bed. Number 4, you may want to consider eyelid scrubs daily or twice daily to keep the eyelids clean. To sum it up, a chalazion is a common eye condition that can affect your daily activities. If you suspect that you have a persistent chalazion that's not responding to treatment, do consult a doctor for proper diagnosis and treatment. Remember, early intervention is the key to a faster recovery. Thank you for watching our video on Chalazion. We hope you have found it useful and informative. Do leave any comments or questions below and we'll be happy to answer them.